Over 4.5 million South Africans have diabetes, many of whom are unaware they have it, and it's now the leading cause of death among women. Among men, only TB kills more people, and this week the Groote Schuur Hospital in Cape Town launched a state-of-the-art diabetes centre, the first public healthcare centre of its kind in Africa. But for this disease to be properly managed, people need to seek diagnosis and follow treatment as prescribed, which isn't always easy. Professor Joel Dave is an endocrinologist and heads this new unit. Congratulations, Prof. It's always nice to have a great and technically updated place in which to do the best work that you and your team can do. Why are so many of us South Africans undiagnosed?
Thank you very much, Annika, and thank you very much for having me on your program. Well, unfortunately, this pandemic of diabetes is spreading faster than many people can predict. And, behind the scenes, the symptoms can be quite non-specific. So many people don't realize that the symptoms that they have are actually due to diabetes. You could also have diabetes before you actually develop symptoms. So we really do need well-defined and very widespread screening programs, screening people that are at risk for potentially developing diabetes. So a lot of work still needs to be done around the world, but especially here in South Africa and Africa, to try and identify those that currently have diabetes but don't actually realize they have it.
What are some of the early symptoms that could lead one to rush to a screening?
So the classic symptoms are increasing thirst and increasing urination, especially at night. People may become dizzy, they may develop blurred vision. So those are 2 or 3 or 4 of the most common symptoms that should alert someone. But unfortunately, many patients who currently have diabetes but don't know it, they may present with a complication. So tingling in the feet, decreasing vision, any form of chest pain, any of these people also need to really be screened for diabetes.
Prof, many of those who are then diagnosed don't adhere to treatment or make lifestyle changes, and that's really important. What kind of complications do you see from that?
Annika, you're 100% right. Look, we're all creatures of habit, unfortunately. And habits are difficult to break, but it's some of the habits that are very important, because lifestyle changes can really help you manage your diabetes very well, or in some lucky people, you may actually even be able to reverse or cure the diabetes with lifestyle changes. Eating the wrong foods is paramount to causing poorly controlled diabetes. So really adhering to a good diet, really adhering to a reasonable exercise program can really help and go a long way to managing diabetes.
Is this pandemic getting worse? And if so, why?
It most definitely, unfortunately, is getting worse. The current estimate is that there's about 463 million people living with diabetes. And the International Diabetes Federation projects that by 2045, there's going to be over 700 million people living with diabetes. The commonest type of diabetes is type 2 diabetes. And this is largely driven by lifestyle, and especially people being overweight or obese. And there's no doubt that the two pandemics of diabetes and overweight and obesity are paralleling one another, with many of those who are overweight or obese at vastly increased risk of developing diabetes. So that is the #1 risk factor for developing type 2 diabetes.
All right, thank you so much. We need to get ourselves screened as soon as possible, especially if we seem to be high risk, and we need to tell our friends and family too. Thank you so much, Professor Joel Dave, head of the new Groote Schuur Diabetes Centre.